Hi guys. So I'm going to take you through the self-study for this particular case through the micro rather than making several different organism videos. There is one video at the end where I go through kind of interpreting bacterial diarrhea timelines that I do think is really useful that I think you should watch. And otherwise, I'm just going to kind of point out things as I go through the document. This document really focuses on parasitic infections of the gastrointestinal tract. We haven't covered a lot of parasitic infections. I mean, we've covered malaria, which is, the big gun, and then Babesia and Toxoplasma. And we'll cover more as we go through the curriculum, but this is the bulk of your gastrointestinal parasitic infections, and I'm just going to point out the ones that I think you need to pay particular attention to, okay? Okay, so the one thing I will say, for all parasitic infections, and I've said this since the beginning of the year, you always need to be able to recognize the diagnostic and infectious forms. So if I show you a picture of it, I want you to be able to look at this and say, this is Entamoeba Histolytica, okay? And this is the trophozoite form, okay? So if I've shown you a picture of it, I want you to be able to recognize it, even if at this stage it's just matching it, okay? And the reason for that is you need to know your diagnostic form and you need to know your infective form. You need to know what kind of form your patient could experience at and what you're looking for when you're trying to figure out what they have. If it's a worm and you're looking for an egg, you're going to be in big trouble, okay? So I have those highlighted for each organism, diagnostic form, and it lists it under, infective form, and it lists it there. So we're starting right off with Entamoeba Histolytica. This is a good one to know. It's pretty common. It's got a worldwide distribution. It's really associated with anywhere from asymptomatic carriage to amoebiasis. This one can cause pretty nasty diarrhea. It's an invasive diarrhea, amoebic dysentery, and kind of the ways you can get it. So this is one of the ones that I would spend a little extra time on. I've put some treatment guidelines in for every single organism. I do not plan on testing you on that, and I will see if I can get better clarification from Dr. Bradrick on that. I more care that you know the disease and how we can find it and how we can diagnose it. Giardia, you have to know Giardia. Giardia is the most common parasite diagnosed in the US. It's also a major pathogen of our best friends, the dogs, and other animals that drink standing water outside. Once again, diagnostic, infective form, you got to know that. I show this because it actually has a pretty interesting shape. This is basically a vacuum that is on the organism, and it allows them to kind of suck onto our epithelial tract and attach there. So it's kind of a neat adherence structure. The clinical syndromes here, you're really looking at diarrhea, abdominal cramps, flatulence, diarrhea. For most patients, this is going to be fine after about 10 to 14 days, but occasionally you're going to see this hyperplasia and necrosis of the gastrointestinal tract. It's a pretty important organism. Make sure you go through that. Cystoisospora belli. It used to just be known as Isospora belli. Read through it. This is not one I'm all that concerned about. It does have worldwide distribution, and you can see, once again, it's one of those that causes a foul-smelling chronic diarrhea, weight loss, malaise, things like that. Here are your images. Cryptosporidium parvum. You got to know Cryptosporidium. This is one that we associate with a lot of different people. It is worldwide, but it's also found a lot of time, again, in our domestic pets. So we also associate it with people who spend a lot of time with animals because there are a lot of animal reservoirs. So veterinarians, forestry workers, animal care technicians, anybody, zoo workers, anyone who has a lot of exposure to animals are at higher risk. Once again, we're going to see disease. It's mainly diarrhea in healthy individuals. Spontaneous recovery after about 10 days is pretty normal. You can see more severe disease in your immunocompromised patients, and that disease can last for years, so it's a big problem for them. You're going to detect it using either an acid-fast staining method. If you don't remember some of the words I'm throwing around here for the parasites like trophozoite or oocyst or acid-fast method, go back to your Merriam-Kahn self-study from Host Defense, Host Response. I think that's where I introduced parasitology, and you'll be able to find some of it there. Then we're going to move into worms. So nematodes, these are helminths. Nematodes are basically large, cylindrical, non-segmented worms. So we're going to start with Ascaris. This is sometimes referred to as the spaghetti and meatballs worm, which you will see in a minute. And I am sorry, if you have a weak stomach, you might want to look away. This is the big pink worm. It's got a couple diagnostic forms. These are the eggs, the fertilized and unfertilized eggs. And the embryonated egg, or the fertilized that's already mature egg, is the infective form. You can find it anywhere. These are the worms being expelled from the body of somebody who's been treated. And this is kind of the classical picture. I'm sorry to do this to you, but this is how everyone I have ever met has learned about this organism. So there you go. You've been initiated. Okay, then we're going to move on to Entamoeba vermicularis. This is pinworm. You have to know pinworm. Everybody knows pinworm. It's a small white worm. It's really familiar to parents who find them in the perianal folds of their infected child. Parents don't often find them, but what they do find is a kid that's like crying because they itch so badly. And then you go, oh no, I hope this isn't pinworm, and inevitably it is. Luckily, it's more of an annoyance than anything. You're going to get this really, really bad itching in a very unpleasant area, which of course itching and scratching there by children can lead to secondary bacterial infections like pink eye as they itch and then scratch. And it's highly contagious because they itch and then they like go and pick up a toy, and then another child grabs that toy, and you see how the cycle goes. So daycare centers, anywhere children gather, schools, and also long-term care facilities we associate with that. So this is an example of the pinworm. You can see these tiny white worms there. Diagnosis, really it's just clinical manifestation. This intense pruritus in a child, you're going to assume it's pinworm. But you can also look for the eggs on the anal mucosa, and the best way to do this is actually with Scotch tape. So you're just going to take like a tongue depressor almost, or a paddle, and you're going to expose the sticky surface, and then you're just going to touch it several times to the perianal region, and then you're going to smooth that tape on a slide, and you'll be able to see the eggs. It's a very simple test, 90% sensitive, especially if you do it right after the child wakes up. So you have to know pinworm. Whipworm, again, just know what this egg looks like, be able to identify it by whipworm. The capsule here, the kind of plugged capsule, that's kind of a good indicator of it. Once again, this one is going to cause kind of some weird things. It's often associated with like an appendicitis. But that's kind of the only thing you need to know. You get these secondary bacterial infections because it can penetrate. So that's kind of that one. Strongyloides, Stork, Hollis. This one is fairly common. It's not one I pay a ton of attention to, so I wouldn't spend too much time on it. But we do see, pain, tenderness, vomiting, diarrhea, and malabsorption associated with strongyloides. Okay? All right, then we get into kind of how do you read a clinical vignette. And this video here, the one that I've got all highlighted and big, it's still uploading right now, so I can't tell you how long it is, but I think it's only about 15 minutes. You have to watch that video. I think it's going to be really helpful to you, okay? And it's just going to go through kind of the 4 scenarios we associate with bacterial diarrheas. So we have a toxin-mediated diarrhea, we have a partial mucosal invasion, which toxin-mediated can actually be split into 2. So you have toxin-mediated that happens really fast, and then you have toxin-mediated that takes a day or 2. And then partial mucosal invasion, we're going to see like fever. It's going to be a little bit longer, 2 to 4 days. And then complete mucosal invasion would also be in that same category. And then anything that's longer than about 4 days, it's not a bacteria, it's a parasite. But watch the other video and you'll find out. Good luck.